Is everybody ready? Can everybody hear me? Well, go ahead and get started. First of all, I want to thank everybody for taking the time and coming out here, and we're going to be sharing some good information. We have this PowerPoint presentation is in the handouts that we handed out everybody. So if you have any questions or you want to, when you get home, all the information that's going to be up here is on it's stapled, it's in your package. All right? Again, back in 2010, we moved our retirees out of our plan, and we placed them in the Presbyterian plan. And at that time, things were working out good. The Affordable Care Act came into play. We moved our retirees from the Pres plan to that one exchange, and we thought it was going to work out fine. Unfortunately, we tried that out for 2 years, and it didn't work out. They told us that they could do some things with the reimbursement, and that's where you were having to pay them the $150, and then we would get reimbursed. We've had issues with a number of our retirees. I think out of all of our retirees, we've only had maybe one or two that have never had any issues. So with that being said, we went back and we looked into it. The trustees looked into it, and when we moved the retirees out of our plan to one exchange in Presbyterian, we did it to help the plan save some money. Our hours were low, the man hours weren't coming in, and that's how the plans are fixed. So if the guys aren't working, our members aren't working, there's no money going into the trust, benefits keep coming out. So we had to to look at it really hard and see what we wanted to do, because we're one of the very few locals that still subsidizes our retirees. And we'll continue to do that as long as, the hours are up and we could do it. So we're always looking for ways on how we can save money and still provide the retirees the benefits that they need. I wouldn't be here if it wasn't for our retirees, and I think we owe it to them. And, as long as I'm the manager here, we're going to fight, and we're going to try to keep the retirees, keep subsidizing retirees. How long that's going to go for, I wish I had that crystal ball that would tell me, but unfortunately I don't. But all I could say is, if our members are working, we're going to try to keep our retirees subsidized one way or another. We went out, we looked at different plans, and we talked to Humana. And this one here, it came up under the General President Sellers. He started this probably about 3 or 4 years ago, that he wanted all the plans to be under Smart Humana. Our trustees do not want to move the regular members into this, but this is a good fit for our retirees through, and this is through the international, and we're subsidizing the cost for that. We've also understand that some of our members like the Pres plan, so there's going to be an option. You can either go with the Humana Smart plan or the Presbyterian plan. What we're going to do today, Nate is going to start off her presentation with Humana, Smart Humana. She's going to give that presentation, and if there's any questions, she'll be more than glad to answer them. And then once that presentation's over, I think Roseanne's going to come up, and then she's going to give her presentation on Presbyterian. Okay? So with that being said, I'm going to turn it over to Natalie.
Thank you, Vince. I'm Natalie Heller, and I'm with Humana, and I come from Louisville, Kentucky to come see you today. So we appreciate you all taking the time to come out and hear about your benefits. We recognize that change is, scary and lots of information to kind of absorb. We did send out educational kits, and I do see that most of you brought those with you today. If you did not get a kit, could you raise your hand? We have some extras, and we can give you one. All right, and then we also gave folks on the way in a copy of the presentation, as well as some flyers about Humana. So if you did not get a copy of the presentation because you came in later, make sure you see, Vince or myself after the meeting, and we'll make sure you walk away with one. They're up here on the table. But as Vince had mentioned, this is a Medicare Advantage plan that is sponsored by Smart International. They wanted to have a Medicare Advantage option for the retirees that are sheet metal workers. Come January 1st, there's going to be over 5,000 of your peers that are enrolled in this Medicare Advantage plan. So just know that there are others of you across the United States that are taking advantage of this. Yes, ma'am.
Can you speak into that mic?
Oh,
It's pretty hard to hear you back here.
this mic, we don't have it hooked up to the PA system, it's for the video.
You're more than welcome. There's some chairs up front that you can sit in, and I'll certainly try to project more. This Medicare Advantage plan is a custom group employer plan. This is not the plans that you can buy on the individual market. These are custom and unique to SMART. So if you are enrolled in a Medicare supplement plan today or an individual Humana plan, those will be going away on January 1st. This will be your new plan. So if you have neighbors or friends that are in a Humana individual plan, this plan will not match their plan. So please be sure that any questions around the benefits that we're going to discuss today are directed at the customer service phone number that's listed in your kit, because this is a custom group Medicare Advantage plan that Humana is offering. So today we're going to talk about what Medicare Advantage is. That may be a new term for some of you. Some of you may already be on a Medicare Advantage plan, and others may be on a Medicare supplement plan. We're also going to talk about the benefits of the plan. So the medical and the prescription drug benefits, what those are, we're going to go over those in detail. We're also going to talk about the enrollment process and how that's working, as well as some extra services and programs that come in the Medicare Advantage plan that you're going to be enrolled in on January 1st. So Medicare Advantage, this is simply the government allowing, or Medicare, allowing private payers such as Humana the right to administer Medicare benefits on their behalf. This means that private payers such as Humana pay the claims for Part A and Part B on behalf of Medicare. You are not losing your Medicare coverage or status. You are all still enrolled in Part A and Part B. You still pay your Part B premiums through your Social Security check to the Social Security Administration. None of that changes. You are not losing your Medicare status. This Medicare Advantage plan simply says that Humana can pay those claims on behalf of Medicare. So instead of your provider billing Medicare and then billing a secondary plan, they just have to bill Humana. We're going to include all that secondary coverage, all that enhanced cost share into one integrated plan that also includes your prescription drug benefits. So your Part A, your Part B, as well as your Part D and your supplemental coverage will all be rolled into one plan. So you're going to have one ID card, one customer service center to call. Your providers just bill one entity, that's Humana, and it makes it easier for you. Less paperwork, less hassle, less administration on your part. So that's going to be a difference and a simplification for you if you choose a Humana plan. So a little bit more about Humana. We've been in business for over 50 years. We're a top Fortune 100 company. We have been serving retirees since 1961. We actually started out as a nursing home business, and then we moved into health insurance. We've been working with Medicare since 1987, offering Medicare Advantage plans later on when those were brought in 2000. So we have almost 7 million Medicare Advantage members today enrolled in the Humana plan. And as I mentioned earlier, over 5,000 of those are with the SMART sheet metal workers. So we're excited to share that with you. We have providers nationwide, and we're excited to be joining with Local 49 to offer this benefit come January 1st. So let's talk about your benefits, the medical benefits of your plan. Within the kit that you all received, there is a summary of benefits for both the medical and pharmacy. So you have this for your review at home or later whenever you would like to review it. The plan we're offering is a PPO plan. A PPO plan does not require you to pick a PCP. You do not have to have referrals. You choose when you need to see a specialist and who you need to see. That is your choice. We have hospitals, doctors, providers, physicians, all of those within our network. The benefits that we're offering to you today are custom. That means that your in-network cost share is the same as your out-of-network cost share. So there is no difference for you as a member whether you choose a PAR or a non-PAR provider. Your benefits pay the same. You do not have to use a network provider. You can see any provider that accepts Medicare and will bill Humana. So whether or not your provider today is contracted with Humana, as long as they'll bill Humana, you can still see them, except for Presbyterian. And that will be separate, and Presbyterian will be offering an HMO plan for you that if you use Presbyterian providers, then you'll elect that plan so that you can continue to see your Presbyterian providers. So if you do use non-Presbyterian providers, and that is not an issue for you, then you can use the Medicare Advantage plan with Humana, and those providers will be covered. We have no copays for preventative services, and the benefits work the same whether you're in New Mexico, Texas, Florida, California, Arizona. This plan is portable. It works in all 50 states, and your cost share is the same, regardless of where you seek care. As long as those providers take Medicare and bill Humana, then you can see those providers. Humana, we pay our non-par providers the Medicare allowed. So we pay them 100% of the Medicare fee schedule. So they're going to be getting paid as if they're working with original Medicare, minus what your cost share is. If you choose to see a provider that does not take assignment and does not bill Humana, you can still see them, but you have to pay up front and then submit that claim to Humana to be reimbursed afterwards. And that kind of puts you in the middle, so we don't recommend that retirees do that. We recommend that you pick a plan that allows you to have that full coverage and that you don't have to pay up front and then be reimbursed later. But that is an option if that ever does come up, and we wanted to make you aware of it. So for your medical benefits under this plan, you have a $147 deductible. A deductible is the amount that you pay first up front before the plan pays. So $147. The great thing is that the maximum out of pocket on this plan is also $147. So once you have paid the deductible, you have satisfied and met the MOOC. After you have paid $147, this medical plan covers everything at 100%. There are no copays, no additional cost share. So you will go seek your care from providers and hospitals at no cost to you. So that's a great benefit on the medical side. Again, it's just $147 out of pocket. The plan covers durable medical equipment, so your BiPAPs, your CPAPs, diabetic supplies. If you have anything of that nature for hospitals, outpatient, inpatient, these things are covered for you. Emergency room services, those are covered. This plan covers chiropractic care. So if you have spinal manipulation of the spine and the bone adjustment for chiropractic, Medicare covers that. So our plan covers that. And the great benefit about this plan is that Sheet Metal Workers Smart International, they added a hearing aid benefit. So if you need hearing aids, this plan gives you a $3,000 allowance every 3 years to use towards the purchase of a hearing aid, one or two. And we also offer a $50 allowance towards the cost of your office visits for your hearing checkups. So this is something that's not covered by original Medicare, which is an enhancement, and we wanted to share that with you.
Can I ask you something? I already got a hearing aids, and if I have in 3 years, can I get new hearing aids?
Yes, well, once you're on the Humana plan, whether you have hearing aids today or not, if you need to update them, you start off with a $3,000 allowance. So you can use that however you deem fit for you. For the pharmacy drug plan, I wanted to share that Humana's pharmacy drug plan on the group plans is different from our individual. We offer an open formulary for our prescription drug plan. An open formulary means that all Medicare approved drugs are on our formulary. So you have open access to all Medicare approved drugs on the formulary. The formulary with Humana has 4 tiers. Tier 1 is generics. So if you are taking generic medications, they'll fall in Tier 1. Tier 2 is preferred brand drugs. Tier 3 is non-preferred brand drugs. And Tier 4 will be all the specialty drugs. We have formularies that are online, and I have a copy here that I'll leave with events. And what this formulary is going to show you is the drug name. The second column shows you the tier, and the last column lets you know whether or not any medication that you take requires a prior auth or a step therapy. Most of you are probably familiar with prior authorization on prescription drugs. Your provider typically works with the pharmacy and they fax information back and forth if you have drugs that require prior authorizations. So on January 1st, if you choose the Humana plan and you start to use your pharmacy benefits, if there are drugs that require prior authorization, you get a 30-day transition fill, and that allows you and the provider and the pharmacy time to work together to get that prior authorization on file. So I wanted you to be aware of that. We provided you, when you walked in the door today, a really nice educational flyer that explains what prior authorization is, step therapy, and then of course there are information on the back that if your provider has questions, he has a phone number that he can call to get those prior authorizations to Humana. But typically, I see pharmacies handle that between the provider and the pharmacy, and they get that information and put it on file. Humana's prescription drug plan also gives you the access to a mail order program. Humana Pharmacy has their own mail order program. We wholly own that. We've got locations in Arizona and Cincinnati. So if you would like to do mail order, that option will be available to you. So let's go ahead and jump into what the prescription drug benefits under the Humana plan look like. This plan has phases. You've got zero cost up to the $3,310, and that's what CMS or Medicare calls the initial coverage limit. Once your total drug costs, what you paid and what the drugs cost, has reached $3,310, you then move into what is called the coverage gap. And that's, or the donut hole, you've often heard of it as that. So in the coverage gap, you pay a different cost share until the cost of your drugs and what you paid and what pharmacy has paid up to $4,850. And once all those costs reach $4,850, then you move into the catastrophic phase of the plan. So for the tier 1, for the initial coverage limit, tier 1 drugs at retail, 30-day retail, those are $5 per script for 30 days of pills. Tier 2 is $30. Tier 3 is $60, and then your tier 4 is 33% with a max of $300 per script. You're also able to get 90 days at retail if you like as well. If you choose to do 90 days at retail, you simply take the cost share and you multiply it by 3. So you're getting, 3 30-day scripts, so that's $15 for tier 1, $90 for tier 2, and $120 for tier 3. We do not do 90-day specialty at retail or mail. Just keep that in mind. Once you move into the coverage gap, if you choose to use the retail pharmacy, your cost share is still $5 for generics, but for tiers 2 and 3 and 4, you pay a 45% cost share. And that 45% is based on the cost of the drug at the pharmacy. So you can always shop around and see which pharmacies offer the lowest cost for the drug that you use, but it will be a co-insurance that you pay. When you do move into the catastrophic phase of the plan, and not everyone does, catastrophic phase of the plan indicates that you've got pharmacy spend over $4,850 for the year. When you move into the catastrophic phase of the plan, your copays change. You pay $2.95 for generics, $7.40 for brand drugs, or a 5% coinsurance, whichever's greater. So you do get some cost relief if you do get to the catastrophic phase of the plan. Under mail order, this is 90-day mail order through Humana. If you do use mail order, tier 1 drugs are at no cost to you. So your generic medications for 90-day supplies through Humana mail order is $0. For tier 2, it's $60. So that means you're saving a copay. So there's a cost savings if you guys use mail order. Tier 3 is $120 for 90 days. And again, as I mentioned, there is no 90-day dispensing of specialty drugs for either retail or mail order with Humana. We have come to see that specialty drugs have shelf lives. They've got adverse side effects and they're high risk. So we keep those on a 30-day prescription only, since if members have adverse reactions and the drug has to be changed, there's less waste and there's more safety for you in case there's shelf life issues. When you move into the coverage gap in the mail order program, if that's what you choose to use, it's $0 for your generics for tier 1, and tiers 2 and 3 is 45%. That will be your cost share. With Humana Pharmacy, if you want to sign up for the mail order, we provided in your book, the very last page, a really nice flyer that overviews how to sign up for Humana Pharmacy mail order. So once you get your Humana ID card, and that'll be in December, after you're effective, you'll need to call Humana Pharmacy and to register. You have to sign up and create an account. You let them know your name, your address, where you want your drug shipped, what method of payment that you're going to use, and then your provider will be able to send Humana your prescriptions. You will have to get new mail order prescriptions. Those don't transfer. Any prescription at retail that you've got refills left on, those are fine. You simply show your pharmacy your new ID card with Humana, and they'll adjudicate those claims under your new benefits. But for mail order, your doctor will have to write new scripts. And he can get those to us. There's 4 ways that are listed on the back of that flyer. They can phone them in, fax them in, mail them in, or go online. And you're even able to go online and get a claims form and complete that yourself and send it to us. But it's easier if your doctor does it for you. So we've got 2 pharmacists that check every order before they go out the door. So there is quality checking to make sure you're getting the right drugs. They come to your home, and then there also is a very good reminder system that we can set up through the Right Source program for the Humana program so that you can get that information on when it's time to refill so that you're never out of drugs. Once you're enrolled in the Humana plan, there are some programs that become available to you. When you walked in the door, I provided you guys with a nice flyer, and it says health and wellness. And these are just a really high snapshot of some benefits that will be available to you come January 1st if you enroll in the Humana plan. We have a Humana First nurse line that allows you the opportunity to call Humana if you have questions about medical conditions, situations. They're there to help you, and it's at no cost to you. We also have Silver Sneakers program. I also gave you a flyer on Silver Sneakers as well. It's got a phone number on it and a website. So after you're enrolled in Humana on January 1st and you have your ID card, this is access to free gym memberships. We partner with Healthways through a Silver Sneakers program, and there are facilities that are near your zip code that you can sign up for free. So it's a free gym membership. And that's a great benefit. We have a lot of seniors that really enjoy this particular benefit with Humana. I think it's our most well-liked. We also have clinical programs. So as you are enrolled in the Humana plan and you start using your benefits, if we notice that you might have a condition that we can help with, we do have nurses that make outbound phone calls to our members to ask if we can help and partner with you on your healthcare journey. And I give these examples all the time. I was doing a meeting for another client, and I had a retiree raise her hand, and she's like, I just want to say that I am smoke-free for 6 months because I've been working with a Humana personal nurse. And she's helped coach me through staying off of cigarettes, and I'm smoke-free. And she says, I still talk to her, once a month, and so that relationship didn't end. There was another lady, and she was probably in her 80s, and she'd had a heart attack. And she said, I don't know what I would have done if my personal nurse with Humana hadn't called me, because I got all these bills and claim questions, and the doctors were using all these big words, and she said it was really important for me to have that person at Humana to talk to, and they become a really nice friend. So if we do call you, please join and volunteer and participate. You don't have to. It's voluntary. You can always opt out. If you don't want us to call you, you can opt out of that as well. But I did want you to know that we will be calling if we can help you, and it's not spam or something inappropriate. Oh, we also have Humana Rewards. So Humana Rewards is a wonderful program where as you get your preventative screenings, breast cancer screenings, colonoscopies, flu shots, cancer screening, diabetic screening, we're tracking those in the claims. So when you have done 4 more, we will send you some information in the mail that allows you to go online and redeem 5 $10 gift cards to various vendors that we use. Shell Oil is one of those. So you can go to, Target, Best Buy, those types of things, TJ Maxx. So it's just a way for us to say thank you for the wellness things that you're doing for your health. Within the Humana plan, what we do is, in order for us to get information to you around the services that you're using, instead of us sending you transactional explanation of benefits, so every time you go to the doctor, you get a piece of paper in the mail that talks about what your plan paid and what you paid, we do monthly statements. So they're similar to credit card statements. So all your services in January, we'll send you a statement in February. And it'll list out all the providers you saw, hospital visits, and it'll show what you paid and what the Humana plan paid. You'll get one for medical, and you'll get a separate one for pharmacy. So on the pharmacy smart summary, it will track all your prescription drugs, and it'll show you how far along you are on the phases. So it'll tell you how much you spent in the initial coverage limit and how much you're spent in the coverage gap. So that's a great tool to help you track where you are on the phases, so you know what your cost share is going to be when you go to the pharmacy. So that's a wonderful tool. And these are generated, of course, if you don't get any health services done in January, you won't get a smart summary in February. But only for the months that you have services rendered, you will get a smart summary the following month. They're a month delayed. We also house these on Humana.com for you to view as well. So if you lose your paper copy, you can always go back online and print another one off. We do have My Humana. So if you are web savvy and you like to go online and create an account, once you get your Humana ID card, you can use your member number to go to Humana.com and register. And that allows you to create a My Humana homepage, and you can track your claims there, look up pharmacies, check the pricing on drugs. We have a really nice cost comparison tool. So you can type in your drug and how much you take and the strength and your zip code, and it'll pull back pharmacies around you, and you can check the cost of the drugs. So that's a nice tool. So if you like to do that, we have that available. I already mentioned Humana First, and then we have a customer service center that takes the smart calls. The customer service center that's going to be answering your phone calls is located in Louisville, Kentucky. So all of those questions and comments are answered out of that call center. They're open 8 a.m. to 9 p.m. Eastern. So keep that in mind. You'll need to move that up 2 hours since you guys are on Mountain Time. But the phone number is 800-733-9060. And that is also listed in your kit. So you'll always have that with you. And when you get your ID card, this is going to be printed on the back of it as well. So you can call us at any time. Your Medicare ID card, your original Medicare card, you will no longer need to show that to providers. On January 1st, the only card you're going to show them is your Humana card. Whether you go to a hospital or a provider or a pharmacy, with the Humana plan, you only show your Medicare Advantage Humana card. You're still a member of Medicare, it's just that Medicare is letting Humana pay claims on behalf of Medicare. So if your providers accidentally bill Medicare, they're going to reject that claim because they're going to say, Jane Doe, you're already in a Medicare Advantage plan. Humana's supposed to be paying your claims. So that might slow things down for you. So just be sure that as soon as you get your Humana ID card, let your doctors know. Let them know that you're switching insurance on January 1st. That allows them plenty of time to make sure that if there's anything with your care that needs to be coordinated through Humana, that those conversations take place. That way, if you've got any scheduled shots or procedures that are coming up in January, your provider can call Humana and have that prior authorization conversation. And therefore, there's no interruption to you as a member. You will also get from Humana a welcome call. So within the first 90 days of being on the Humana plan, someone from Humana will call you to administer a survey and ask you if you have any questions about your health insurance. So that's just one way for us to make sure that you understand the plan and that you've got all your questions answered. This welcome call is actually Medicare required. So all carriers do these calls. So let's go over some frequently asked questions. As I mentioned earlier, you still pay your Part B premium, as you do today, to the Social Security Administration. None of that changes. Local 49 is going to be paying your premium for the Humana plan. So that no longer is a function that you have to do. If you choose to enroll in a non-Humana plan or a non-Presbyterian plan, Local 49 will not cover those premiums. They will only cover premiums and reimburse them for the Presbyterian plan and the Humana plan. If you are enrolled in an individual Medicare Advantage plan today through One Exchange, you will not have to cancel that on your own. When Humana enrolls you through the Medicare Advantage plan with Humana, it'll automatically cancel any Medicare Advantage or Part D plans. Medicare only allows you to be enrolled in one at a time. So once Humana processes your enrollment, it'll disenroll you from that plan. If you are on a Medicare supplement plan, your ID card that you have in your wallet does say whether or not it's Medicare supplement. If your card reads Medicare supplement, you have to call and cancel that yourself, because your enrollment in the Humana Medicare Advantage plan will not automatically cancel it. So you need to cancel that. Otherwise, those premiums will still be due, and you'll have to pay those, and they're not going to be reimbursed by the fund. And a Medicare supplement plan does not coordinate with a Medicare Advantage plan. So it'll be additional coverage that you do not need. So keep that in mind. Yes, sir.
Even though it's a Humana plan?
Even though it's a Humana plan. So if you have a Humana Medicare supplement plan, cancel that. Make sure you don't pay any premiums for January. Finish it out your December month. Let your carriers know that I need to be covered through 12/31 of 15, but on January 1st, I will have new health insurance in a custom employer group Medicare Advantage plan for both my medical and my pharmacy, so I no longer need this plan. All right? So just keep that in mind. It'll be important that you take action if you have a supplemental plan. If you have dental or vision plans that are individual today, you keep those. Nothing changes. And you should keep them, because the Humana plan does not cover routine dental and vision. The Humana Medicare Advantage plan does not cover through the SMART program routine dental and vision. Medicare Advantage plans only cover vision conditions tied to eye conditions, macular degeneration or glaucoma. So those services your medical plan pays, but a routine eye check, glasses, no. And on the dental side, we only cover dental injuries or dental conditions that are assigned to a medical condition, like a cancer or an accident. Where there's a medical need, then we'll cover it. But routine cleanings and routine, root canals or fillings, Humana's plan won't cover that. So if you have individual Humana plans, or you have other individual plans for dental and vision, or you've got something through Local 49, you can keep that plan. Okay? Yes, sir.
So you do offer dental plans on separate?
Yes, Humana does offer individual dental and vision plans. You can sign up for those, they're voluntary, and you pay 100% of the premium. But they are available at Humana.com. There's an individual portal, and it's called Humana One. And we offer dental and vision plans. And there's a lady in the back, I'm gonna get her question. If you are in an individual Part D plan through any carrier, Humana, WellCare, etc., any individual Part D plan will term automatically when we enroll you into this 49 plan with SMART. If you have premiums that are being auto-deducted from your checking accounts, it's very important for the MedSup folks to make sure you call and cancel and tell them to not take the money out. You can also let your bank know too. If you're writing checks, just don't write any more checks for any January premiums. Yes, sir, and then I'll get to you.
These premiums for the dental and eye care, either through Humana or the ones we have, will they be reimbursed?
No,
Not even through the local?
no. Local 49